Hello, James Weber here from RegistryReady.com, here for our next installment of Test Question Breakdown. Here designed to give you a little bit of feedback on how to break down National Registry style test questions to help you get to the right answer. So let's break this first question down, shall we? Multiple trauma and multi-system trauma patients are situations in which an EMT must perform which of the following? Respond above and beyond the call of duty, practice outside of the scope of practice in order to provide the greatest good, to anticipate and treat problems with a greater level of complexity than usual, or to provide the best quality care possible, including definitive care on scene. Now, for those of you guys reading through these questions, if you decided that you believe the answer is C, then you would be 100% right. But let's talk about why. Now, the rule of thumb with these style test questions is you can immediately remove two questions that are very much incorrect. Now, let's try to figure out which two of these options are definitely wrong, right? Good. First, B. B says to practice outside the scope of practice. Now remember, scope of practice is actually a guiding document that tells us what we're permitted to do as EMS providers. So at no point will a situation arise that requires you to be able to perform something that's outside your previously established skill set. So B is definitely not the answer. And D is definitely not the answer either, and let's talk about why. D says to provide the best quality care possible, including definitive care on scene. So definitive is an interesting term. Definitive care in a traditional delivery model is a hospital, right? Because we in the field don't have the ability to fix most problems completely. And because we don't have the ability to fix most problems completely, we don't really qualify as definitive care. Definitive care is a hospital that has, lab testing and, CAT scan machines and x-rays, places that have the ability to do diagnostics and to provide some semblance of a diagnosis to a problem and provide a treatment plan. That's definitive care. We are not, nor will we ever be that. Our job is to stabilize patients and transport them in a reasonable way to a facility, right? So that only leaves A and C, right? Respond above and beyond the call of duty for A and anticipate and treat problems with a greater level of complexity than normal. Now, respond above and beyond the call of duty, there's really no situation where someone would be required to respond beyond the call of duty because by definition that would no longer be the call of duty. Like if I required you to do something that's above and beyond the call of duty, by proxy of it being a requirement, right? It's no longer above and beyond the call of duty. Conversely, C, right? Anticipate and treat problems with a greater level of complexity than normal. That's important, and that's an important portion of the question because it really highlights the types of treatments that you're going to provide to a patient experiencing especially multiple trauma and multi-systems trauma, because that portion of the question is really designed to demonstrate to you that you're not just dealing with John that has a bruise or Jane that has a broken arm. You're dealing with a patient that's having significant problems and multi-tiered, multi-level problems. These are often patients that vary in severity and have varying reactions across the body, right? So because they vary in their severity, but have multiple problems, that word complexity in option C is what makes option C the most correct answer. So if you chose C, you're 100% right. Let's go to the next question. How many lobes do the right and left lung contain combined? 3, 4, 5, and 6. The answer is C. The right lung has 3 lobes, the superior lobe, the middle lobe, and the inferior lobe. The left lung has 2 lobes, the superior and the inferior lobe. Now, breaking down this question is kind of hard because it really doesn't have any complexity to it. There is lower level questions that you'll experience when you take your certification exam that simply require you to know the answer. This is a vocab question. This is a, what color is the sky? Blue. It doesn't require you to deduce an answer. It doesn't require you to break down the question. So often when we talk about in your program, in order to be successful, you must know the vocab. If you don't know the vocab, you are not going to be successful. Just keep in mind that this is a good example of why, right? A question like this is a really good example to why. Good. So let's talk a little bit about our third and final question, which is the most important intervention an EMT can implement for an unstable multi-system trauma patient. Airway management, oxygen, cervical spine precautions, and rapid transport. So the answer, in case you're wondering, a lot of people defer to oxygen. The answer very much is D. Here's the reason why this makes a difference. When we talk about putting together correctly the answers to a question like this, it's important that we're clear on the fact that we only provide care that's appropriate and consistent within the question, right? So, for example, question A very specifically says airway management, although there's no portion of the question that actually stipulates that there's an airway problem that's required to be managed. B, oxygen. Well, there's nothing in the question that suggests that the patient requires oxygen, right? C, cervical spine precautions. Again, there's nothing that suggests that the unstable multi-systems trauma patient requires cervical spine precautions. There's simply not enough information in the question to be able to answer A, B, or C. One of the biggest hangups we have when it comes to National Registry style test questions is that we insert data into the question that simply doesn't exist. And in this circumstance, this is a really good example of that. And in a more overarching, in a more broad way, just keep in mind too that the only real fix for unstable multi-system trauma patients is a surgeon, right? It's often been said that the only true fix to trauma itself is to get the patient as quickly as possible to a surgeon in an operating room for the care that they truly need. Their instability and the lack of specifics in the question is really what makes D the only true answer. So hopefully this helps give you some insight about how to break down National Registry style questions. And like always, we appreciate your time, your patience, your energy. We appreciate your trust in the RegistryReady.com product. Hopefully it helps you in your journey. If you have any questions, reach out to me at the email below. And like anything, have yourself a great day. Good luck at your exam.